Hi, Brush on Block followers. I am Dr. Heather Rogers, and I'm so excited to be here to answer your questions. Before we get started, I was asked to tell you a little bit about myself. I am a board-certified dermatologist in Seattle. I started in Washington. I'm a Washington girl. I went to Stanford for undergrad. I was actually on the sailing team there and spent a lot of time in the sun and putting on sun protection. I then came back to the University of Washington for medical school, where I fell in love with dermatology. I then went to Columbia University Medical Center in Manhattan for my residency and fellowships. And that's where I really fell in love with the treatment of skin cancer and the prevention of aging due to the sun. And that has been my focus ever since. I moved back to Seattle, and then I opened a dermatology practice called Modern Dermatology with a dear friend of mine, Dr. James Collier, and we have a great time. We have an incredibly busy practice, really, really fun patients. Amazon's our landlord. And also in the last couple years, I started a clean skincare line called Dr. Rogers Restore, really trying to make products that were safe for the entire family, things that you could count on when your skin was irritated or recovering from a procedure. My skincare line is sold all over in dermatology offices, online, and a great deal of retailers. So that's a little bit about me. So now I want to spend a little time talking about Brush on Block. So I'm a big fan. Brush on Block, I think, does one of the best jobs of creating sunscreen that's powder and it's easy to apply. And the reason why I'm such a big fan of this brand in particular is that people are always confused with powder. Is it coming out? Is it working? How can I know if I've used it? And the Brush on Block sunscreen is A, mineral, which is very important, but B, it has this little clicker at the bottom, so you know if it's open or if it's closed. And so unlike the other powders, you can know, okay, this one's open, I can put it on and get results. Where and who do I recommend this product for? Really everyone. I'm a big believer in making it easy to reapply your sunscreen. So every morning I want you to put sunscreen on your face, on your neck, and your chest. But then after that, when you get out and you're going around your day, it's really hard to reapply. It's gonna mess up your makeup, it's gonna make you feel greasy, and the Brush on Block fixes that. So you can just put it on, and I have people use it everywhere, on their face, on their neck, on their chest, on their ears. I think it's great for parts. I think it's great for balding individuals because they have too much hair for sunscreen, and the powder can protect them. It's wonderful for athletes, for the tennis players, for the golfers who don't want to get their hands greasy. They can reapply as they switch sides on the tennis court with the Brush on Block. So I do feel like this is an important component of everyone's sunscreen wardrobe, and why it's so important is that it takes away the hurdle of having to reapply something thick and greasy throughout the day. I am now going to answer a whole bunch of questions that came in, and there's actually so many questions I have notes. So I'm going to go through these questions. Feel free to DM us as we go along if there's things you want more information on. My Instagram handle is dr.rogers, doctor spelled out. So the first question that came in is from Maureen. Do you really need different sunscreens for face and body? And the short answer is no, you don't. You can use Brush on Block on both places. Usually face sunscreen is a little bit more cosmetically elegant. It's a little bit more expensive and it's tinted. And so that's just more than you need to put on your entire body. Oftentimes you can use something cheaper, something that might make you a little bit more white on your body because you need to have more of it. The next question was by Taryn. Does sunscreen clog your pores? Yes, sunscreen can clog your pores, as can makeup, as can sweat, as can a bunch of different things. So in general, if it's a hot, sweaty day, you need to wash your face before you go to bed. Really every day you need to wash your face before you go to bed. And that's the most important thing from preventing your pores from being clogged. Should we use a separate sunscreen product around your eyes, was the next question by Robin. No, you don't have to. If you're using a mineral sunscreen, so a zinc-based sunscreen like Brush on Block, you can use it all over your face as well as around your eyes, and you don't need a different product. Chemical sunscreens can be irritating to the eyes, and so if you use a chemical sunscreen, then yes, you want to use a mineral sunscreen around your eyes. The next question, how much sunscreen should we use in order for it to be effective? I think everyone is a habitual underuser of sunscreen, and it only will work as well as we do in applying it. So if you are naked and going to the beach in your bikini, you're supposed to use a shot glass of sunscreen every time you reapply. I don't know anyone, including myself, who does that. So you need to err on using more sunscreen than you think. And in addition to that, you really need to reapply. So even if you do a crummy job the first time, the second time you can do a better job. Sarah then asked, I have sunscreen in my makeup. I also wear sunscreen over my makeup. Does this mean I'm double covered? Unfortunately, no, it doesn't. Sunscreen is not accumulative. So if you have an SPF 15 in your makeup and you put on an SPF 15, that means you only have an SPF 15. You don't have an SPF 30. In general, I recommend you use an SPF 30 every day. Kristen then asked, how long do I have to wait to go outside after applying sunscreen? Well, the good news is with mineral sunscreens, you don't have to wait. Mineral sunscreens, or sunscreens with zinc in them, start working the second you put them on your skin because they're a barrier. Chemical sunscreens have to be absorbed into your skin to become effective, and so you need to wait 20 to 30 minutes before they become fully effective. The next question was by Emily. I have rosacea on my face. Do I need to use a particular type of sunscreen? Individuals with sensitive skin like rosacea are going to be more likely to be irritated by chemical sunscreens. So I recommend physical sunscreens to everyone for a lot of different reasons. Physical sunscreens are sunscreens that have zinc in them, and zinc is a natural anti-inflammatory, so it's great for people with sensitive skin. It's safe to use on kids, but it also is a natural mineral that does not accumulate in us or in our world, and I think that's just as important as having good sunscreen. Julia asks, how do I get rid of sunspots on my face? So it's easier to prevent sunspots than it is to make them go away. Wearing sunscreen every day is an important part of that. Vitamin C serums in the morning also help prevent the development of brown spots. Using a medication at night that promotes cell turnover like tretinoin also helps lighten brown spots. And then if that isn't enough, you can always have them lasered off by your dermatologist. The problem is that sunspots will come back if you go into the sun without sun protection. So if you're trying to fight age spots, you need to wear sunscreen, you need to wear a hat, and you need to wear sunglasses. Last question was by Christopher. How long does sunscreen keep? Sunscreen is required to have an expiration date on it that's 2 years. And so that's how long it should last. If you do a good job storing it in a cold, dark place, it may last longer. But here's the deal. It shouldn't stick around that long. You should be using it often and frequently, so you need to buy new sunscreen every year. Okay, that's all we have time for. Again, my name is Dr. Heather Rogers, and I'm so excited to be here with you. Brush on Block and I have some exciting news coming soon, so please continue to tune in. And if you have any questions for me, just DM me at dr.rogers, and doctor spelled out. Have a great summer.